me in on why you wanted to use a flex bar for tennis elbow.
I want to use a flex bar for tennis elbow because the literature shows that if you do slow, isolated eccentrics, it helps tendinosis.
Okay.
Okay? But I couldn't send patients home with a 10 pound, a 20 pound, a 50 pound, a 60 pound weight to do that because you got to overload the tendon to get it better. Controlled load. So we're all sitting around the clinic. We're like, how are we going to overload the tendon? We have a Biodex $50,000 machine that goes slow and overloads the tendon. But we took this flex bar from Performance Health Academy. What we did was we found a way to overload it, okay?
Okay.
By twisting it.
Okay.
So, would you like to see the medial side or the lateral side first?
Let's start with the lateral side.
The lateral side is for tennis elbow.
Okay.
Okay. So what we do is we put the arm in full wrist extension.
Okay.
We twist, we maintain wrist extension, and then we slowly lower it. See how these are different here? The diameter is different.
Yeah, the green's thicker than
The
the red,
green
yeah.
is thicker. That provides more resistance
Okay.
than the red. But for you, a scrawny guy like yourself might need to use the yellow bar, okay? But actually, the yellow bar provides resistance. What if the resistance is too much and you have pain? We know that pain's not good for you. So
Do the exercise?
it can be a little discomfort, but you don't want it to be painful. What if you can't do the yellow flex bar?
Okay.
Okay? How do you keep it pain-free so the patient can work the extensor carpi radialis brevis, which is implicated in tennis elbow? You can use this product here, put it just around the fingertips, but you can work that one tendon nice and pain-free, okay?
All right.
And start with reps of that. So load it and slowly unload it, okay? And it usually takes probably a day or 2 or 3 to get through this exercise.
Okay.
I'm gonna do it with the red bar. So we're gonna externally rotate all the way, okay? We're gonna come in and reverse grip this. We're gonna maintain this external rotation, all right? As we twist, maintaining external rotation, and then we're slowly lowering. Good. Excellent. Now, it's that easy, okay?
Okay.
Yes, people can get the bar from a performance health provider, but it's always good to have a physical therapist teach the patient or the client the exercise 2 or 3 times because there's common mistakes that everybody makes when they move this. One of them, do the bar,
Okay.
external rotate, twist, and go and release quickly. That's one of the most common mistakes. If you don't slowly lower it, you don't get better. Another one is this. They start neutral, right? They twist, so now they're going from there to there. They're not working the full tendon,
Okay.
all right?
You really need to externally rotate as much.
You got, that's not external rotation actually, it's wrist extension.
Wrist extension.
You need to fully go into wrist extension, okay? So, and then the other common fault that we saw where people didn't get better is they death grip the bar. You can see over here, a nice grip there, you're red. If you death grip the bar, see how that blotches like that? So they're death gripping the bar and it's causing too much stress on the tendon and they don't get better, all right?
All right. Well, now what about the medial side for golfer's elbow?
The medial side. Funny you should ask that question because you have the yellow bar in your hand, right? Usually you don't start with the yellow bar for the medial side, son. Okay? Because look at your arm. You see how you have all this big group of muscles here?
Yeah.
And you have this scrawny little band of muscles here.
Yeah.
Produces more force, you need more overload.
Okay.
Okay? Because the overload is what remodels the tendon.
Okay.
Okay? So usually we'll start people out with the red bar for the medial side.
Okay.
Okay? Certainly in your athletes, they'll probably start with the green bar.
Okay.
But you can start them with the red bar. And the way, full extension. See how you deviate there
Yeah.
to the inside? I don't want that. I want straight, full curl there.
Okay.
All right? Now this is a little more difficult than the lateral side.
Okay.
Grip there and twist. Great job. Extend fully, maintain that full flexion, and slowly load it. All right, let's try that one more time.
Okay.
Fully deviate, here, here, extend, and unload, slow. All right?
All right.
Usually some of our pro athletes start with the green bar.
Okay.
It's more resistance, and then eventually move to the blue bar.
Yeah, that's a lot more resistance.
A lot more, ton more resistance, yep. And you can see how you need the more resistance with the medial side versus the lateral side, where usually the red bar does it after you get through the initial pain-free contractions. Remember, it can be painful, but not crazy pain. You just want a little discomfort. If it's too painful, you gotta back off and go a little lighter with maybe the red bar or even the yellow bar.
Okay.
After the twisting, just maintaining proximal stability for distal mobility. So doing some external rotation, doing some scapular stuff. So the CLX band comes in very, very useful when we're working with patients with medial and lateral epicondylitis, because yeah, we're isolating on the structures that are implicated. But if you have weakness here, okay, or weakness down low, then this structure is going to take up more stress. If these structures can be stronger, then indeed we can take off stress on the medial and lateral side of the elbow. And in shoulder patients, the two muscles that are usually weak are the serratus anterior and the lower trapezius. Okay? And one of the great exercises that we're able to do with this is we're able to do dynamic hugs. And we put it around right here, down by the inferior angles, and we have you grab here, and we might have you grab here, here, right there, good. Now what John can do is throw on some goggles to protect his eyes, like I tell all my patients.
Yep.
Okay?
Thank you. Here we go.
Like I tell all my patients. And then what I'd like John to do is, John, I want you to hug me, but don't touch me. Exactly. Working the serratus anterior and slowly come back to the starting position. And that's the exercise. Hug me, but don't touch me. Go again, John. And you can see how he's working his serratus anterior here, and he's slowly lowering it. That's a real key exercise, John, for lowering it, okay? And then if that's too hard for you, we can quickly transition into the next loop, making transition John, if you fatigue out, we can transition into the next loop to make it a little bit easier. Hug me, but don't touch me. There you go.
Yeah.
See how that's easier? See how the 8-loop progression there makes it easy to transition from harder to easier, or even from no knots, no nothing. You just change the loops to make it harder or to make it even easier. So
That's great.
that was awesome, John. One of the other things that we do with this loop, so I no longer send my patients home with five bands with 3 knots in them each. Okay, I send them home now and have them buy a CLX band. And Bob McCabe's study showed that by doing this exercise, you actually work the lower trapezius more than the manual muscle testing position. So John, if you could stand there, good. Exactly like that. And if you could just lift your heart, perfect. And now externally rotate out like that, you'll see, and Bob McCabe showed in his study, that it actually works the lower trapezius more than the manual muscle testing position. So now, John, with one band, I've just worked your serratus, your external rotators, and the lower trapezius. You know what? This band with those flex bars is a recipe for success with medial and lateral epicondylitis. Thank you and have a great day.